Hello, my name is Dr. Raja Adnan Ahmed, and I'm a psychiatrist. I work in UK, and with me, I've got Dr. Zara, Dr. Anum Zara, who is a trainee in psychiatrist, and she's working in Republic of Ireland. And this session is especially for the doctors who specifically ask about the training pathways and how to work as a doctor in Ireland, Republic of Ireland. Just remember there are two islands. There is Republic of Ireland, which is an independent state, and then there's Northern Ireland, which is part of UK. So Dr. Zara is a 2020 graduate from Lahore, and she's currently working and training in Ireland, working in training in psychiatry. So I thought it would be a good idea to get her on board and get some of her history and story, how she managed to secure the that training. So, Dr. Zara, thank you very much for joining and giving time.
Thank you so much, Dr. Adnan Ahmed, for having me. It has always been so pleasure to talk to you or to follow your page or anything. You are quite an inspiration for all of us, for all of the junior doctors. Thank you so much for having me. Yeah.
No, thank you very much for joining and giving time. So, if we start with your own journey, if you don't mind sharing, about yourself first, and then we'll talk about Ireland.
Yeah, sure. So, I'm a graduate of 2020. I have graduated from Lahore, Sharif Medical College, Lahore. So, when I was doing in my final year, so I thought that I will be during that time when you have ward rounds and all these ward attachments going on, you feel like, no, I don't want to work here. When I will be finishing up my internship, I'll be definitely going abroad. So I was exploring my own options, different kind of ways. Like I had few options in my mind that includes UK, obviously Australia, and
Mhm.
then till that time I never knew anything about Ireland. Then I was in my internship. I started preparing for the English language proficiency exams, and just to know that after that I can secure a PLAB slot or give any other further exam for registration of different countries. So as soon as I finished with my exam, I was exploring now more options for PLAB slots. I was waiting for PLAB slots to be released so that I can book my PLAB one and then go ahead. Meanwhile, it was during the time when I was doing my house job as well. So it was COVID time. I was preparing for PLAB one as well. Meanwhile, waiting for the slot. When the slots were released, I booked a slot, but that was after a year. Like you have to
Mhm.
wait till the exam, and the exam was after 1 year. And apparently, my house job was about to end at that time, and I was like, it's like very long wait, and I have already prepared for it. So I started exploring something more. My dad gave me advice that okay, you should get registered with the Medical Council of Ireland.
Yeah.
That's also very good place to go and work and have your own European experience in terms of your work. So I take on that advice from a few other people as well. So I started getting myself registered with the Medical Council of Ireland. So I'll tell a few bits and pieces about the registration of Medical Council of Ireland as well. So for getting into the general registration, you don't need to pass any kind of exam. It's just like our internship, our Pakistan's internship is
Mhm.
accredited by the Medical Council of Ireland, and you just need to give the English language proficiency exam and then just fill out their own application process. It's
Mhm.
kind of a long application process. It takes some time. You need to be patient enough to be to for all the stages of the registration, but you will get it done by approximately 7 to 8 months. I don't know how is it now, but at that time it take around 7 to 8 months.
So when you
So
say English proficiency exam, this is IELTS or OAT you're looking for. And is there any scores you look out for? Any specific scores?
yeah, the scores were the same. Like you need to get the 350 above in
Okay.
like we need to do in the UK if we are
Mm.
going to UK. And if you are sitting for PLAB exams, you need the English proficiency. It's the same IELTS and OET scores. Yeah,
And
350 above B plus.
And when you're filling the application form, is there anything specific they're looking for or anybody? Because if it's just about filling an application form after internship, then there will be a lot of Pakistani doctors who will be able to do that. But was there anything specific they were looking for when you were giving registration?
Yes, that's a very good question. So they have a certain criteria that those people who have done their internship after the year 2000, I suppose it's 14 or
Mm,
2013. After that, and then they have done their internship after that, and then they have their own work experience. It can be of 1 year, it can be of 6 months, that's okay.
mm,
But they have some kind of work experience and done their English language exam. That's it. These three are the main things. And then when you submit your application, you provide your PMC certificate, which
mm,
is Pakistan Medical and Dental Council, or Pakistan Medical Commission's certificate that you are registered as a practitioner, as
mm,
a medical practitioner. You have to provide that as well. And then during the time they raise a few more informations. They check your like your eligibility. They would ask your degree. They would ask your different kind of. So it depends from person to person. One of the member from the registration council get in touch with you if they need further information or further detailing of anything. So you can always provide them your evidences, and then once it's finished, then they ask for good standing certificate from the PMC. And then good standing certificate, you just have to apply online on the PMC website, and then it will directly go to the registration body here
mm,
in
mm.
Ireland. So in that way, this
Mm.
process goes on. Yeah.
And then about after registration, securing a job there, how do you do that?
So yes, it's kind of a difficult process to secure a job, I would say that,
Mm,
because you have to wait. There are particularly two main time frames when the jobs are going on. So one is July induction and one is the January induction. So if somebody who has, like, my case was similar, I got my registration in January, but at that time I was applying for but I was not able to secure any of the interview. But nearly to July, I kept applying on the jobs, whatever will appear on the
mm,
website. So it's like hsc.ie, which is Health Service Executive, which is the main body of health services over here. So I kept applying all of the jobs over there, but I secured in a few interviews in May,
mm.
and then that was for the July induction.
Yeah.
So this is how it works. Yeah, you have to keep applying for different kind of jobs, but they do appear. They need people, and obviously, you can enhance your CV by doing different courses, or by doing ACLS or things like that. And obviously, they help you in terms of achieving a job. Yeah.
So after your registration, you said you took you about 7 months. How long time it took you to get a job?
So my registration was done in January 2022. But at that time, I did not apply for the jobs because I was in my own mind, in my own space. I was just focusing on PLAB.
Mm,
So I did not apply for a job until end of Feb. So unfortunately, I just wasted the first month and for the January induction. So then after end of February, April, March, I started applying for different jobs. I landed few interviews in May. And one of the interview, I then secured a job. They took the interview one day, and the next day
mm,
they told me that they have offered me the post. It was in child and adolescent psychiatry
mhm.
as a SHO. So I accepted it because I was very much interested in psychiatry from the start.
Okay.
So that's how I then after you, even if you have got the job, still you have to wait for visa and all those kind of paperworks and all these kind of things. So I attained the job in May. I came here in September. So it
Mm.
took me that time. Yeah.
So that's 2022 you're talking about, and when you came to Ireland. So that was a non-training job.
Yeah.
If you don't mind explaining the training structure of psychiatry and how did you get into that? I mean, it was a lower, I mean, a basic training and then high training. How does how do people become psychiatrists in Ireland?
So yes, when you get your initial job, it was like as I did, it was non-consultant hospital doctor, which
Yeah.
is a non job. So after that, I came in September, and in October, nearly to the end of October, they opened the slots for basic specialty training.
Mm.
So training a pathway in Ireland is totally conducted, and the main authorizing body is College of Psychiatrists of Ireland. So they have two ways of training. So one is the basic specialty training,
Mm.
which is for 4 years. So
Yeah.
first year of the basic specialty training is called as foundation year. Either you are coming from a background of already trained in Pakistan or India or any other country, or either you are just coming as a non-consultant hospital doctor job.
Yeah.
So you always have to do the foundation year. It's not a skip. So first year is the foundation year, and after that, 3 years is the BSD 1, 2, and 3, respectively. So that's the 4 years basic specialty program. And after basic specialty, you have higher specialty training. That's for 3 years, and
Mm.
that's kind of a subspecialty in only one in one subspecialty of psychiatry. Whereas when we do the basic specialty training, after every 6 months you rotate into different subspecialties of psychiatry. For example, first one is old age, and second is adult. Third will be CAMS, then it will be forensic, liaison. So it's kind of a different, you have to rotate after
Mm.
every 6 months. So we have in Ireland the application process of psychiatrist training starts in October. So they open their applications in October, and then anybody who have done their internship before the application portal has been opened are eligible to apply for the training. Along with they need the same things. You must be done your internship. You must have your English language test. You must have either general registration of Medical Council
Mm.
of Ireland, or you are eligible for the specialist registration of Medical Council of Ireland. And for junior doctors who are coming like as myself, we hold the general registration when we are coming over here.
Mm.
And those who have the general registration, they are also eligible to apply for specialist training. So that's how it works. Yeah.
And then what is the process? So this is what will make you eligible. What is the recruitment? How do they recruit you? Do they do interviews? Do they do any exams? How do they recruit you?
Yeah. So when you fill out the yeah, first of all, you fill out the application process. When it's
Mm.
sent over, then they close the application process. You have to give two names of the. I don't know how is it now, but at my time it was two of your own consultants reference, and.
Mm.
It's like they will directly contact the consultants, not myself, and the consultant will give them my report about how they have observed me working over here. So two consultant references, and after that they will shortlist you for the interviews. There's no written exam or anything. It's just the interview. And during
Mm.
the interview, they have a full panel, like 4 to 5 consultants who are specialized in different subspecialties of psychiatry. They will be conducting the interview, and then it's kind of a 40 to 45 minutes interview. And after that interview, then if you have got the slot, they will then tell you that this is that these are the results. There are 9 deaneries here in
Yeah.
Ireland. So there are 9 different colleges, and to which you can get the training. But the interview and the body conducting the interview and the application will be only one.
Mm.
You will be submitting your application, and there will be only one interview. It won't be 9 different.
Mm.
But when you get a post that you are selected for the basic specialty training, then they will offer you another form to tell which is your preferred deanery, and then
Okay. So rank
you can.
them. So the interview you mentioned is only one interview, and you said it was about 45 minutes. What sort of questions they were asking you?
So most of the questions were the questions that they ask in interview are divided into 3 different categories. So first category was your interest in psychiatry and your motivation to do psychiatry. And I suppose that's very, very important when you are going to be a psychiatrist
Yeah.
for whole of your life. You are it's kind of different as compared to the other specialties like medicine, surgery, where the doctors deal with the physical health problems and all medication related
Mm.
things. Here we are dealing with all, along with physical health needs, there are some mental health needs, and there are some other things like MDT, parenting, and all these kind of stuff. So, yeah, the first category was the interest and motivation towards choosing psychiatry. The second category was your own clinical experience, and they ask different clinical scenario questions. So, there are different kind of questions. Somebody who is interested in psychiatry, they know that what kind of questions and what kind of presentations people
Mm.
come when we are on call or when we are in the clinic or when we are working over here in the ward. What are the different challenging situations we get to see about the patients? So some questions were from the clinical scenarios and some from the ethical part, like for example, difficulties with colleague, how MDT works, and these kind of questions. Yeah, and on basis of all three combination, then they will give you the your result
Interesting.
score.
So you said the first one was about interest in psychiatry, second is the clinical scenarios, and then the ethical scenarios.
Yeah.
What's the thing? All right. And then you said you would rank your different deaneries, and then based on that, based on your score, you will be allocated. So during your training, I think, is there an exam? Because like in UK, we have to pass MRC Psych exam to move from the basic training, which is our core training, to our specialist training. Do you have also have an Royal College exam there?
Yeah. So our first two exams are the same. So when you got into the training, now the training is run by the college body and your deanery. So
Mm.
you have a learning outcomes grid. You have to fulfill all of the learning outcomes, and then it will be done by yourself and your
Yeah.
supervisor supervision. It's kind of a formal supervision, and there's some informal supervision as well. There's an other kind of e-portfolio that has to be maintained by the
Yeah.
virtual and the teaching in the hospital, so those kind of things. But along with all of that, you have to pass exams as well during your BST, basic specialty training. So we have three exams. The first two, MRC Psych paper A and paper B, are similar as they are in UK. So, but the third exam, they have their own exam here. And the third
Mm.
exam is the clinical exam. It has further two parts. So, first part is clinical formulation and management exam,
Yeah.
and second part is OSCE. So,
Okay.
they have their own clinical exam, but the first two exams are similar as they are in the UK.
Okay. Um, and I think the other thing as people would be interested about would be the immigration status. So what type of visas you get, and is there a chance of that visa becoming nationality as well? Because a lot of people would be interested to see if they can get a passport of Ireland.
Yeah. So when you come over here on your first job, which is non-training job, which is non-clinical hospital doctor job, so you get stamp one. So stamp one is like it's for the doctors, it's for the skilled workers particularly. So that stamp one is for 2 years. And as soon as you complete 21 months on stamp one with your work permit, like when you are working, paying taxes and
Mm.
all of that, and you complete 2 years, you are granted stamp four.
Mm.
And on stamp four, then you are now eligible to apply for the citizenship over here. But you still, while you are on stamp four, still you have to wait till the window opens. And usually it takes, after you have stamp four, it takes usually 3 to 4 years to get your citizenship, and then I suppose one more year for the passport. So in total, after stamp four, it takes usually 4 years,
Mm.
and before stamp four, it's 21 months.
So it's about 6 years in total, 7 years you
Yeah,
can get. Yeah. Yeah. Okay.
almost 5.5 to
Mm.
6 years.
Okay.
Yeah.
And what is your experience like as an international graduate or a Pakistani living in Republic of Ireland? Because when people think about the European countries, UK or Ireland or anybody else, they think, it might be, they might feel too isolated, they might feel out of place, they might feel that, they are lost in the new system. How was your experience? Were they welcoming? How did you find them?
I suppose it depends on person, every person's own experience as well. But to my experience, it was very good. To be honest, they are very welcoming, very generous, and very warm people. And
Mm.
my first job was my with my consultant, who's also an immigrant, who
Mm.
was at that time. So in that way, we relate to each other a little bit more. She was from Italy, and in that way, it was kind of a more understanding
Mm.
we had developed about each other. But apart from workplace, wherever you go for your own things, it's kind of very easy. So I've always felt very welcoming, and I've
Mm.
always felt them very
Mm.
helpful. Wherever you get stuck, whenever you ask for something, it's like they will do it. So and they won't let you feel like you are asking for
Mm.
something extra help or anything like that. And but apart from that, obviously when you're away from home, you always feel like a
Yeah.
bit homesick and all of that. Yeah.
So some of our Pakistani colleagues or some Muslims colleagues will ask these questions around, do you get halal food? Do you get like grocery shopping, which is multicultural? So how do you find Ireland in that sense?
Yes, it is very like the options are limited. I would agree as compared to UK,
Yeah.
because if you compare, obviously the options are very much limited. But wherever you go, you can always find a halal grocery store, halal restaurants. They are there, and very good ones as well.
Mm.
So I suppose Dublin is a bit more explored in terms of that because it's kind of a capital. But apart from that as well, even in smaller areas as well, you can always find good grocery stores. It's not a problem.
Mm.
Yeah.
I think the last question would be around the salaries, because I think this is again a very important point for junior doctors. They always compare that, this is how much I get in UK, or this is much I was getting in Pakistan or India. So how much, if you don't mind sharing, how much do you earn like after tax a month in Ireland as a junior doctor?
So it depends how it depends on your calls. So how many calls do you do? So
Mm.
basic salary. So over here we get pay after every fortnight.
Mm.
So we get paid fortnightly. So first fortnightly, when we get paid during the first 2 weeks, it's basic salary, and the next after next fortnight, it's kind of an additional along with your pay, or if somebody is working in A&E, their
Mm.
A&E allowance, or all these kind of stuff. So I suppose it depends. Sometimes it's kind of a less when you are not doing that much calls. You are only earning about the basics,
Mm.
and if you are doing like normal calls, which people do like 3 in a month or 4 in a month, that's kind of then it's kind of a good manageable. And then if somebody wants to do more like 6 in a month, uh, I think it's not practical going beyond that. But whoever wants to do, if they do, then they
Mm.
earn a little bit more. And taxes are also depend. It depends on your grade. So for SHO jobs, they have the grades from SHO 1 to SHO 7. And then for registrar jobs, they have the grades from registrar 1 to registrar 5.
Mm.
And according to their grades, their salary, it depends and it varies. But I would say that thankfully it's comfortable living. You can make a trip back home, and you can also live good life over here. Yeah.
So do you have opportunity to do locums as well? This is where you're saying extra money if you have to earn.
So no, we can't do. If you are in training, you can't do locums at
Mm.
all. So when you are in basic specialty training, you are not allowed to do locums. If somebody is coming on just on the non-clinical hospital doctor job,
Mm.
initially when they have stamp 1, they are not allowed to do locums. The calls means like in hospital, your own hospital
Yeah.
calls, and they are enough. Like they are manageable. You can do always take someone else's call if somebody is leaving their call. So in that way, it's manageable. But when you get stamp 4 after 2 years, after completing 21 months on your
Yeah.
first work permit, on stamp 4, you are allowed to do locums. And then the locum rate and everything, it increases. But I have never done because the
Okay.
way I landed up here, I was directly into the training. Yeah.
And other things around like healthcare and all that, is that free for you? Benefits?
Yeah, so it depends. First of all, you have to register yourself with a GP, which is kind of a very difficult pathway to go through. But when you have registered yourself with a GP, and then your bloods and your these kind of things, you want to go and for regular checkups. I suppose these things don't get much of you don't need to pay for them. And also the vaccines, the COVID, flu, and all these kind of
Mm.
things. Our own occupational health department is very good in terms of that, and they always cover you for that. Thankfully, touch wood, I've never had any kind of
Mm.
problem in terms of that. But whoever my colleagues or my friends have any kind of issues with their health, I've always seen that they get covered. Yeah.
And would you recommend, as just a last question, would you recommend the Pakistani doctors or IMGs to consider Ireland? I mean, given that you have good experience as well now, um, would you recommend this pathway to them, or you any advice for them if they are thinking of this pathway?
Yes, I would definitely say. I would say that it's always we only limit ourselves to the options that we know from our
Mm,
seniors, from our parents, or from other our friends. But it's very good way to explore other options.
mm,
It's the system. The hospitals are very organized. The teams are the supervisors, consultants, and even the other healthcare staff. They are very supportive,
mm.
and the overall people, the general population over here are very well welcoming and very sweet. So I would definitely say that I'm a big advocate for
Mm.
people, whoever wants to come, you should definitely consider it. It's very good opportunities and very comfortable living and very good thing. Yeah.
Any advice for the juniors who are listening to you, like who are at a final year or housed up stage in Pakistan?
Yeah, I would say that if you have always thought of going abroad, then start making your own pathway. Start exploring from final year or from just fourth year, end of fourth year. I know that people are now a little bit more advanced. The young people are more advanced in terms of that. But I would say it's very important to just see different options, not just limit yourself to if you want to, then it's okay. No offense to any specific country or any specific exam, but explore your options, make your pathways. Always think about the second option. If god forbid you don't land up or you don't end up finishing up the first option, you don't know that
Mm.
god has something else much better for you as a second option. So always explore in terms of that. Always have something some good knowledge about the second option or a second pathway as well. Yeah.
Okay. Thank you very much for joining and sharing your experience.
Thanks very much, Dr. Adnan.